Well, we all know exercise is certainly good for our weight, our body shape, also extremely important for our heart. And here to talk about just how much of an impact pulmonary and cardiac exercise can actually make for your body is Blair Gorsuch from IPMR. He's the Director of Wellness and Exercise Psychology. Thanks so much for joining us today.
Thank you. Thanks for having me.
So we're talking about a new program that you guys have really close to us here at Landmark. So can you talk about the cardiac exercise, pulmonary exercise program?
Right. We started December with Landmark, kind of on a joint venture to set up a cardiac and pulmonary exercise class. We originally were in the main exercise area, but then Landmark had some space that they offered to us. So we have about 1,600 feet dedicated to the program. We have a cardiac nurse in to monitor the cardiac exercise, and a respiratory therapist in to monitor the respiratory patients. So these people need to have a referral from their physician to come in, but once they come in the door, they have an individually prescribed exercise program that's set up for each person that starts.
So who do you typically see come into these classes? Who's a candidate also?
Most of these people are a little bit away from an event that they may have had in the past. The cardiac patients are generally 3 to 6 months post heart attack, surgery, angioplasty, stents. So they may have been through a more formal inpatient cardiac rehab program before we see them. So they're looking more at our program as a maintenance, something that they can continue to do for the rest of their lives, hopefully. The pulmonary patients are pretty much the same. They may have been an inpatient program or an immediate outpatient program with a hospital in town. And again, they're looking for a program that they can do for long term.
Right.
So it's a program that is not covered by insurance. A lot of people ask, well, is this an insurance covered program? No, it's an out-of-pocket program, but we've tried to make it affordable for the people that can come in. And they can either come 2 or 3 days a week.
And it's really something that if you don't take care of this part of your life, can really have some severe implications on your health and maybe redo everything that you just had some troubles with.
Right. The main focus is on the exercise and the activity, but there's a lot of education that goes on too, because you're trying to prevent a reoccurring event on down the road. So the more you can keep the individual's compliance with this type of a program, the more likely they're going to be to stay healthy long term.
Definitely. And remind everybody again, more about the program, where they can find it. Also, if they just want some more information, how they can get that too.
They can go on the IPMR website, which is ipmr.org, and find the program under Wellness. They can go to Landmark to visit the facility. We're there from 8 to 3 Monday through Friday, so they can just drop in and introduce themselves. A referral is required, but we can do that for them, so it takes kind of the burden off of the patient to go back and contact the physician to do that. They can also contact me. I'm Blair Gorsuch, 621-4106 at IPMR.
Okay, wonderful. And of course we'll put this interview on our website too, so that viewers at home can check it out and get all of the information they need. We really appreciate you being here today.
I appreciate you having me.
Thanks
Thank you
so much. We'll be right back.